If you've ever had your blood pressure checked at the doctor's office, then you may have heard the phrase hypertension. Hypertension simply means high blood pressure. And in today's video, we are going to cover everything you need to know about this common condition. The word hypertension comes from the Greek word hyper, meaning high, and tension, meaning pressure or stretching. So essentially, hypertension is a condition where the force of blood pushing against the inner walls of arteries is consistently too high. This can make it harder for the heart to pump blood around the body, and over time can cause serious damage to vital organs like the heart, brain, and kidneys. Because of this, hypertension is often referred to as the silent killer. Why? Well, because it usually doesn't cause any noticeable symptoms, and many people are unaware that they have it until a serious problem occurs. In this video, we will look at what causes hypertension, who is at risk, the common signs and symptoms, the potential complications if left untreated, and finally, how to prevent and control this potentially dangerous condition. So let's get into it. Number 1, what is hypertension? We've already covered this in the intro, but it's important to understand how blood pressure actually works. Blood pressure is measured using two numbers. The top number, known as systolic pressure, represents the pressure in the arteries when your heart beats and pumps out blood. The bottom number, known as diastolic pressure, represents the pressure in the arteries when your heart is at rest between beats. Both numbers together give a complete picture of your blood pressure reading. When measuring blood pressure, the normal range is considered to be less than 120 over 80 millimeters of mercury, mmHg. A reading of 120 to 139 over 80 to 89 millimeters of mercury indicates elevated blood pressure or stage 1 hypertension. And a reading of 140 over 90 millimeters of mercury or higher is considered stage 2 hypertension. It's important to note that blood pressure can fluctuate throughout the day and even from day to day. That's why doctors typically take several readings over several days to make a diagnosis. Number 2, major causes and risk factors. So what exactly causes hypertension? Well, the truth is that in about 3/4 of cases, the cause is unknown and it's referred to as essential hypertension or primary hypertension. However, there are some conditions and risk factors that can increase your likelihood of developing hypertension. Some of the major causes include an unhealthy diet, particularly one that is high in salt or sodium, obesity and physical inactivity, excessive alcohol consumption, and smoking. Other causes include having a family history of hypertension, being over the age of 60, having diabetes or another chronic health condition, and chronic stress. Number 3, common symptoms. As mentioned earlier, one of the reasons hypertension is called the silent killer is that many people don't experience any noticeable symptoms, especially in the early stages. However, if blood pressure becomes severe, some common symptoms can include frequent headaches, especially in the morning, dizziness or lightheadedness, nosebleeds, vision problems, and shortness of breath. These symptoms can also be caused by other conditions, so it's important to seek medical attention if you experience them regularly. Number 4, possible complications if left untreated. If left untreated, hypertension can lead to serious complications over time. The most common complications include heart attack and stroke, kidney failure, vision loss, and heart failure. In addition, hypertension can cause other problems such as coronary artery disease, peripheral vascular disease, and aortic aneurysm. Let's briefly go over each of these. A heart attack occurs when the blood flow to a part of the heart muscle is blocked, usually by a buildup of fat or cholesterol in the coronary arteries. This blockage prevents oxygen-rich blood from reaching a part of the heart muscle, causing a portion of the heart to abruptly stop beating. Similarly, a stroke happens when the blood flow to a part of the brain is interrupted, depriving that area of oxygen and nutrients. This can cause brain cells to die and result in permanent brain damage. Kidney failure occurs when the kidneys are unable to filter waste and excess fluid from the blood effectively. In people with hypertension, the high blood pressure can damage the blood vessels in the kidneys, leading to a gradual loss of kidney function over time. Vision loss can occur due to damage to the blood vessels in the retina, the back part of the eye responsible for detecting light and sending visual signals to the brain. High blood pressure can also cause the blood vessels in the retina to become leaky, resulting in blurred vision or blind spots. Heart failure happens when the heart muscle becomes too weak or stiff to effectively pump blood around the body. Over time, Hypertension can cause the heart muscle to thicken and stiffen, making it harder for the heart to pump blood. Finally, an aortic aneurysm is a bulge or ballooning in the aorta, the main artery that carries blood from the heart to the rest of the body. High blood pressure can weaken the walls of the aorta, leading to the formation of an aneurysm, which can rupture, causing a life-threatening internal bleed. So now that we know the potential consequences of leaving hypertension untreated, let's move on to number 5. How to prevent and control hypertension. Fortunately, there are many things you can do to help prevent and control high blood pressure. If you already have hypertension, following these tips can help reduce your risk of complications. First, eat a balanced diet. One of the most important things you can do is eat a healthy diet that is low in sodium or salt and rich in potassium, magnesium, and calcium. These nutrients can help lower blood pressure by balancing the amount of fluid in your body and relaxing your blood vessels. A diet high in sodium can make your blood vessels narrower and increase your blood pressure. On the other hand, a diet high in potassium, magnesium, and calcium can help widen your blood vessels and lower your blood pressure. Potassium, magnesium, and calcium are also important for maintaining a healthy heart and reducing the risk of heart disease and stroke. Next, lose weight if needed. If you are overweight or obese, losing even a small amount of weight can make a big difference in your blood pressure. Exercise regularly. Another important thing you can do is exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Exercise can help lower your blood pressure by helping your body use insulin more effectively, increasing the amount of nitric oxide in your body, which relaxes your blood vessels, and by improving your overall health and fitness level. Limit alcohol and quit smoking. Drinking too much alcohol can raise your blood pressure, so it's important to limit your intake. In general, women should have no more than 1 drink per day, while men should have no more than 2 drinks per day. Smoking damages your blood vessels and makes your blood pressure worse. So quitting smoking is essential if you have hypertension. There are many resources available to help you quit smoking, so talk to your doctor about what options might work best for you. Manage stress. Chronic stress can contribute to high blood pressure, so it's important to find ways to manage your stress levels. Some effective methods include meditation, deep breathing exercises, yoga, and spending time in nature. Take prescribed medication and monitor BP regularly. If lifestyle changes aren't enough to control your blood pressure, your doctor may prescribe medication to help you manage your hypertension. It's important to take your medication as directed and to monitor your blood pressure regularly. Your doctor may also recommend getting a 24-hour ambulatory blood pressure monitoring to get a more complete picture of your blood pressure patterns. In conclusion, hypertension is a common condition that affects millions of people worldwide. While it can be difficult to manage, taking steps to control your blood pressure can significantly reduce your risk of complications. By eating a healthy diet, exercising regularly, limiting alcohol, and quitting smoking, managing stress, taking medication as prescribed, and monitoring your blood pressure, you can keep your blood pressure under control and maintain good health. Remember, knowledge is power, and taking charge of your health is the best revenge. So don't wait. Start taking control of your hypertension today and live a healthier, happier life. Thank you so much for watching this video. If you found it helpful, please like, share, and subscribe.